Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and today I am talking with Minsu Blanca from Healing Oasis Physical Therapy and Holistic Medicine in Miami, Florida. Welcome to the show, Minsu.
Hi, Neil. Thank you for having me.
Well, let's get right to it. You practice physical therapy. Tell us what physical therapy is.
So physical therapy is a modality that helps all kinds of patients get better, return back to their prior level of function after they get hurt or after they undergo surgery. And it could help anybody from a child to an elderly patient. Usually when people come to see me, they have either gotten an injury of some sort or they had gone through surgery. Those are the basic components for traditional physical therapy.
So really, we're talking about people of all ages that have had some kind of injury or a surgery which has restricted their movement. Is that correct?
That's right.
All right, awesome. Well, what do you see most of in your practice, or who do you work with? Is it the younger generation that have sporting injuries, or do you deal more with the older generation that are just having movement difficulties?
Well, luckily, my practice is very varied because I use a traditional approach combined with a holistic approach to physical therapy. So I could see in any given day a child and end up my treatment with an elderly person or a young adult in the middle. So what keeps my practice fresh is that I get a variety of patients regardless of the age group and complaint.
So let's talk about the type of person that needs to go see a physical therapist. What kind of challenges might they be having in their life that makes them pick up the phone or walk in and see a physical therapist?
Well, one of the main things that people call for is because they have back pain or neck pain. Those are the two main components that are going on in today's society. So definitely if a person is suffering from any kinds of back pain or neck, shoulder pain, they usually think about physical therapy. However, if a person has also had a car accident or they had gone through an orthopedic surgery or even a breast surgery, they might also need physical therapy because the tissues are going to be impaired as well as the joint.
Mm-hmm. So explain what you do with them then. Once they come to you, you say back pain and neck pain are two of the most common things. How do you handle that?
Well, Neil, each patient is individual and they might be suffering from, for example, back pain. One person might be suffering because they had an injury at work. One person might be suffering from back pain because they had an accident, or the other one might be carrying their stress or emotional trauma in their back. So because of the type of treatment that I do in my practice, I use a holistic approach as well to see what it is that each patient has. So each treatment might vary depending on what it was that brought the patient there to see me. It's not everybody with back pain is going to get this, and that. No, we evaluate the patient and see where the problem is coming from, and together we merge and we go into discovering what it is that caused the pain in the first place, and then get to the root of the problem. And that's how we deal with each patient on a one-to-one basis.
So there's a lot of factors now that are causing back and neck pain, and it's a lot to do with the habits that we employ on a daily basis. Talk to me about some of the things that are the causes of maybe more of the chronic pain that people have in their back and neck.
Well, with the chronic aspect, what we see today is a lot of people are sitting down a lot in their computers. A lot of our work environment is very sedentary. So even sitting in the monitor for a long period of time, it's going to give you some issue. It's going to give you an issue with your back. It's going to give you an issue with your shoulders, with your neck, especially looking down at your cell phone. A lot of people work with their phones and their neck, the position of the neck goes out of alignment is going to cause an issue to that person as well. So it's important to teach the patient, to take breaks, to get up, to stretch, to move around, not to sit for such a long time without taking a break, because the back is getting the blunt of that position. So you need to compensate and do strategies to alleviate the body from this type of everyday minor traumas that you're causing.
And there seems to be a lot of businesses that are well aware of that. I know back pain or lower back pain really causes a lot of time out from work. So there's a number of things now that employers will do to help people to either move or to stand up. What are some of those things?
Yeah, definitely. There are ergonomic chairs and ergonomic desks that you could get to alleviate this issue, as well as some companies are very avant-garde in the sense that they have desks that actually move up, and you could actually bring your desk up as you stand up to give your body a rest. And that change in position makes a big difference in the body. There are other companies that even have like those big balance balls that you sit on, and it works your balance as well as works your core muscles and gets you strong, so that the back is getting stronger as you work as well, and is not being on that constant sitting position of carrying that load for such a long period of time.
Now, tell me the problem with sitting, because obviously with the ball you're sitting as well, but there seems to be constant movement rather than staying in the one position. Is that what the issue is?
Yes. You are, when you're sitting in the ball, you're actually using your core muscles and you're working your balance as well. So you're strengthening up your abdominal muscles as well as your back. So those are the two main components that help you get a healthy back. Having a strong core and a strong back would help you endure the possibility of not having to go through any issues in your back. So the sitting position, you're sedentary, and what happens is a lot of people do your slouch. So you're slouching forward, you're taking your pelvis out of alignment, and all the weight of your body is going forward. So that is not the proper way that your spine should be, and that's will cause those type of issues as well.
So those are good things to know for preventative measures to try and help you not get that lower back pain. But what happens when people do have back pain and they come in and see you? What kind of things can you do for them?
Well, one of the things that I always do is I teach my patients basic stretches that they should do every morning before they get out of bed. These stretches are important because when your muscles are contracted, that will lead to back pain. That's one of the issues that causes back pain. So I teach my patients basic stretches that I do every morning. And for the people that are having kind of like the type of job that we were talking about, I also recommend that they could stretch at night at the end of the day just to alleviate their back as well. There are things that you could actually do if you're having back pain at your office to help you along. And one of the things that you could do is as simple as going to the pharmacy and getting one of those electrical heating pad and just have like a basic rub, like a sports rub or vapor rub even works. Bengay, some of the things, and just like rub the spot that you are sore at after you stretch, and then just put the heating pad for 15 and 20 minutes, and that would help you alleviate the complaint until you get to see me.
And so what does that do? Putting a heating pad on, and the sports rub, what does that actually do to the muscles that alleviates the pain?
So you're actually relaxing the area where you're hurting. You're working on the tissue, you're working on the fascia. The fascia is getting released so that the contraction that is around that area relaxes so that you don't have that tremendous ache in your back.
So how do you sort these, once you've kind of handled a little bit of the pain, how do you sort these biomechanical habits that people have in their lives?
Well, we have to see where it is that your back pain is coming from, and we correct if there's an issue of misalignment, we need to correct the misalignment to make sure that your joint is back into place and that's not causing you the pain anymore. Because if you don't correct the structural misalignment, the issue is still going to be there. So if it's the misalignment that is causing the issue, then we need to correct the structure and then work around the myofascia to release the tension that has been caused in that area. So we work on that to release that tension so that the area is able to function normally and move accordingly.
Now, when you talk about alignment, probably most people's minds would go to a chiropractor. Tell me what a physical therapist does to align the body different than what a chiropractor would do.
Well, physical therapists can also do mobilization of the joint. We just use the force that we use is different than the chiropractor we use. And we also work with the myofascia, which is what also working with the fascia, you're able to correct the alignment as well.
Okay, now most of the audience here probably know what pain is, but they're probably not familiar with the myofascia. So explain what that is and why it's important.
Yeah, so the fascia, imagine the fascia being like a web, like a spider web. And that's what aligns all of the tissues in the body. So if that web is tangled, it's going to create a knot, and your muscles are going to be restricted in their movement. So by working on that spider web, you are actually moving and creating elasticity and creating the muscle, giving the muscle a pathway to move back to alignment to the place that they're supposed to be so that they're able to function properly. So by working deeply, following this line, you're able to release a lot of the tension, a lot of the pain that the patients have when they come to see you.
Very good. Now, tell me some of the misconceptions about the physical therapy industry.
Well, some of the misconception is that physical therapy is going to hurt. Sometimes, it's going to hurt if you have a surgery and let's say you have a total knee replacement. Yes, it's going to hurt when you start doing the exercises, but the more you do it, the less it's going to hurt. If you come to see me for another thing, it doesn't necessarily need to hurt. We could get you to be pain free without causing you pain. So you don't need to be afraid to come to a physical therapy office to get relief. We could definitely help you with your pain. So a lot of people say, "Oh, physical therapy is pain and torture." No, we do more than that. So that's it's definitely a misconception.
Right. You can gently work them through the range of motion to release those tight areas, which is great. And you can do that also without the need for medicine. And there seems to be a big problem with pain medicine, especially right now.
Yes, that's a big problem. Yes. So we're able to. Yeah, we're able to provide release without having to use those big narcotics that many times are not going to correct the issue, because if it's an impairment of, for example, misalignment, as I mentioned before, it's not going to get any better unless you correct where the issue is. Right.
So tell me what other reasons that might stop somebody from going to see a physical therapist. And I know there's a lot of insurance issues around the industry. You talked about the fears of pain, but what else might there be?
Yeah, definitely. A lot of people will go to the doctor first to get, as you mentioned, pain medication, and they'll say, "Oh no, let me." The easy fix is to go and get a pill to make it better. But as I mentioned before, the pill oftentimes, it's not going to work, and the issue is still going to be there. So, come to see us. We could definitely help you better than a pill is going to be able to help you when it's a structural issue, when it's something that could be corrected just by using our hands. We have a capacity to find out exactly what it is that you need and provide you the help that you need without having to rely on narcotics, without having to rely on pain medication. And your body is going to get better by coming to see us.
Give me an example of somebody that came to you for help. What kind of situation were they in? What challenges were they having? What were you able to do for them? And ultimately, what was the outcome that they experienced?
Well, let me see. I could give an example of a patient that I've seen a couple times. And this patient came to see me with tinnitus, and she has been suffering from that for 6 years, she says, and she's tried everything. She gone to the tinnitus clinic. They had given her the last thing that she was getting for that was Valium, and it got to the point that she was not sleeping at all at night because of the sound so deeply in her ear. And she read that craniosacral therapy could be effective in treating that. So she came to see me, and our first treatment was last week. And I gave her, I did the evaluation, and then I gave her a session of craniosacral therapy. And she wrote to me the next day, and she said that it was the first time that she was able to sleep throughout the night in the last 6 years. So,
I mean, that really is quite remarkable for somebody that has suffered for 6 years, and to be able to go to somebody that can diagnose their problem and knows what the issue is, really is a life-changing event. Why do you think people don't think first to go to a physical therapist and suffer for 6 years?
I think it's mainly an issue here in the United States that people usually go to the doctors first. Where I went to school in Holland, and actually over there, patients call us first if they have an issue. They call the physical therapist, and they go and get treated by physical therapy before they go to the doctor. And many times the doctor calls the physical therapist to find out what it is that their patient has. So I think it's a national phenomenon here in the States that people just kind of gravitate normally to the doctor first. And for many years, to go to a physical therapy, you needed to go see a doctor to get a prescription. Luckily, in the state of Florida, where I am, we have open access, so we can actually treat the patient first without needing a prescription for the first month of treatment. So I think having that opportunity maybe will provide, people just to know that they could come to us and don't need to go through their physician to get help.
And what do you think the cause of that is? Obviously, there's an education issue here to where people are conditioned to go see a medical doctor. Is that because the medical industry has spent so much money on advertising and maybe the physical therapy industry has not?
It's possible that because the system has been in place to always have the doctor as being the primary source of referral, that that's what led people just to go to the doctors initially. I know if you're going to go see any kind of a specialist, you need a referral. So I think it's just the way the system works here in the States.
It seems like such a backward system when you look at other countries in the world that don't have the same issues that we do, especially with medicine. And they are going to see physical therapists first to deal with physical problems.
Yes, I think so.
So tell me a little bit more about yourself. What was your background and why did you decide to get educated in physical therapy?
Well, initially I wanted to go to medical school, and it was just by a situation of life that I didn't end up going to medical school. And when I first came to the United States, we came illegally. I'm Cuban, so we had to we were punished by immigration, and I got offered a scholarship, and then the scholarship was taken away because I was not a legal resident, so I couldn't go to medical school when I got accepted. So I had to wait a few years and then start school again after I became legal. And this was 10 years after being in the country that this happened. And then when I started my second university, my mother got hurt at her job, and I went with her to physical therapy, and I really liked what they did. And I said, well, maybe, this would be a way to still help people. And it seems like a great place to be. I was always in sports, and it happened to be like a sports physical therapy that we went to. And I was like, I could continue down this path. And I was lucky enough, and I got a scholarship to go to Holland, and I studied. That's where I got my physical therapy training in Holland, and I got to see a completely new perspective of treatment approach over there. And then I came back to the States, and I was working at a hospital and rehab center for a few years, and I knew that I wanted to do more. And it turned out that I ended up finding about a healing school, and I study more about it, and I decided that I wanted to integrate that into my practice. So I went ahead and completed 6 years of training of healing school and got other holistic trainings along the way. And what I found out is that when you see a patient, there's a lot more to the physical complaint. So that's when you have to look at the patient as a whole to discover what it is that is causing the issue. If somebody comes with pain, you got to find out what it is that's causing the pain. As I said before, not every pain is equal, and not everybody's suffering from the same type of complaint, even though they're, for example, they might be suffering from back pain. So using both the allopathic and the holistic approach, I'm able to go deeper with my patient, and I'm able to provide a general sense of relief that I was not able to do before just by using the allopathic sense. So I think it's a great compliment to be able to pull out of my toolbox what the patient needs based on what the presenting complaint is and what the patient is exhibiting when they come to see me.
Yeah, I think what people don't understand about physical therapists as well is that you are very highly educated, and to listen to all the studying that you've been doing, it's no wonder that you have the ability to diagnose these problems and help people.
Yes. We definitely are highly educated. All the graduating class right now of physical therapists, they are all doctors. The master program is no longer in place. So, when you go see a physical therapist, the majority are doctors nowadays. So, and what it is because we are trained to sense and to feel with our hands, and we are able to, just observe somebody and see where the issue is coming from. In Holland, for example, where I was trained, like I said, that the patients won't go to the doctor first; they come see us, and over there they don't rely so much on using X-rays for diagnosis. We have tests that we use, and we're able to diagnose the patient based on the test that we give the patient and our observation as a whole. So when we treat the patient, we're going exactly to the source, because many times the diagnosis might be wrong, and it's up to the therapist to find out what it is that is causing the problem, and we're able to do that.
Well, very good. It's been very interesting, and I would like to know a lot more about some of the other services that you offer that complement physical therapy. Maybe we'll have to do that another time, but you briefly, just looking at your website here, you have energy medicine and hypnotherapy as well. Tell me what those two things are.
The energy medicine is the 6-year training that I talked about before, and that is dealing with the energy field, because it is believed that before a disease gets to a body, it formulates out into the energy field first, or the vital field. Thus, by being able to see where the issue is coming from, if it's not already in the physical body, you are able to work with the disease at the energetic level, thus preventing the disease from actually affecting the patient if the patient comes to see you during that time. So we are able to work from the outside in as well as from the inside out.
And with hypnotherapy?
So hypnotherapy is patients come to see a hypnotherapist for a variety of reasons. Some people are just they're having a phobia, for example, and with hypnotherapy, we're able to identify why the phobia is taking place, and we're able to take the patient there so that they're able to work and get rid of the phobia. If they have a trauma, we're also able to work with that patient in that sense with a trauma. Other things are like past life. People are fascinated by past life with Brian Weiss and his books and teaching. So, or a person wants to lose weight or stop smoking, for example, that's another reason that they come for hypnotherapy.
Very good. Well, it's been extremely interesting talking with you, Minsu. Any last thoughts for people that are having problems with pain? What kind of things can they do to, on a general basis, to help themselves out? Yeah,
definitely. Stretch. That's my number one recommendation for all my patients. Stretch every day. Stretching is super important. Hydrate yourself. Drink a lot of water. The water is super necessary to keep your body functioning properly, and exercise at least 3 times a week for half an hour if you can. Those are things that you could do to help yourself maintain, and go see a therapist. Let us help you get back to where you want to be. Don't suffer in vain, and don't rely on pain medications to help you get better. We could help you get back on track without having to rely on narcotics and all that sort of things.
Well, we've been talking with Minsu Blanca with the Healing Oasis, Physical Therapy and Holistic Medicine in Miami, Florida. How do people get in contact with you if they need your help?
Yes, Neil. My phone number here in Miami is 305-389-1768. And my website is MinsuHealingOasis.com. So they could go to the website and get any information, or they could just give me a call, and I'll be happy to answer any questions that they might have.
Well, great. Thank you very much for spending time with me today and sharing your expertise and being a guest on Business Authority Radio.
Thank you so much for having me, Neil.
And to our listening audience, if you like what you hear, hit that like button and share, and we'll see you next time on the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show, or to listen to past episodes, visit businessauthorityradio.com.